Well, it is National Osteoporosis Awareness Month, and do you know the risk factors and how to protect your own bones? UAB nutritionist Dr. Beth Kitchin joins us this morning. Good to see you.
Good to see you too, Mike.
I know this is very important to you, obviously, because of what you do at UAB.
Right. One of the things I do at UAB is I am the osteoporosis clinic educator. So this is a really important month for me, and in fact, I am heading down to the National Osteoporosis Foundation meeting this week, and I'll be speaking there, and I'm going to be tweeting out a lot of information, any new things that I learn. Right. So anyone who's interested, pay attention, and I'll be getting you some more information.
This is a disease that affects our bones,
right.
and this really becomes a risk factor, especially now. I know for my parents, they deal with it now, to where if they break a bone, they just can't maybe get it surgically repaired because of other issues, so it becomes a very serious health issue.
Exactly, and that is the big deal about osteoporosis. I'm going to show you two bone models and what it looks like. This is a pretty normal bone, and when you look at this bone, we're looking at this bone microscopically. You can't see your bones this way, and so if you look at this bone, you can see it's got a sort of honeycomb structure, and there's a lot of bone there. Compare that to this bone. Look, you can see through this bone.
Again, that's
magnified. This is we're looking at this microscopically magnified about 12 to 13 times, and so this happens gradually, Mike. You don't feel this bone loss over time. It doesn't change what you do or how you feel. Like you said with your parents, it's when you break a bone. It's the outcome of the osteoporosis that is so dangerous. And as you can see on the screen there are the big risk factors: being a postmenopausal woman, aging, a family history of osteoporosis and broken bones, and being thin. These are just some of the risk factors, but they're the big major ones. Right. And you can see there's not a whole lot you can do about those risk factors. So a lot of people end up being kind of surprised that they have osteoporosis, but these are some of the factors that can cause it.
What are some things that we can do, though?
So one of the things we're going to talk about today, and in the coming weeks we'll talk about a lot more things, is getting enough calcium in your diet. And so one of the things that I really push with people is getting enough calcium every day. For most of us over the age of 50, 1,200 to 1,500 milligrams is what you want to aim for. Okay. Now, I really stress with people that getting calcium at our age, it's not going to stop or prevent the osteoporosis, but it will slow down the bone loss. It's a really important part of your treatment. Okay. Now, the problem, though, is that when you guys go and look at your foods and you look at the label, and I've just told you need 12 to 1,500 milligrams of calcium, you're not going to see it in milligrams. You'll turn it around, you'll look at the label, and you'll say, Beth, it's in a percentage. I look at this milk, and it says 1 cup, which is a serving, is 30%. Well, take a look at the label that we've got up here, and you'll see that there's an easy way that we can change that 30% of your daily value. That's what that is, 30% of your daily need, which is based on 1,000 milligrams, not what we need. All we have to do is take off that percentage sign, pop a 0 on there, and we've got milligrams.
So 1 cup is a third of what we need.
Of what we need, except that need is 1,000 milligrams. As you get older, you need 15. More calcium. Right. So we need to change it into milligrams. That trick only works for calcium. So what I'm telling everybody to do this week in preparation for next week, what we're going to talk about is supplements, because you might not be able to get it from foods. Your homework this week is to pay attention to your food labels, all the foods you get, and see how you're doing.
All right, you can follow her on Twitter for more on that, at
Dr. Beth K. And you can also follow me on Facebook, UAB Nutrition Trends. As I said, I'll be posting all week about osteoporosis.
Thank you, Dr. Beth K.